Before viewing video lessons, it is important to read the textbook using the learning guide as your turn-by-turn directions. Then use the learning guide to take organized notes in your own words with examples and pictures.
Things I asked everybody to do between classes was take a look at these two different screening tools for sleep. I'm going to look at the sleep diary example first. So this is an example of a sleep diary, and typically if we were worried about somebody having a sleep problem, we would ask them to take this sleep diary home, or we might send it to them before an appointment, and we'd want them to record their sleep habits. When I worked at the sleep clinic, I would usually ask for at least 2 weeks of data. And so you can look at what some of the questions are. There's a set of questions that you complete before you go to bed. So at the end of the day, you would talk about your caffeine consumption, your exercise, medications, because medications can interfere with sleep, napping, if you felt sleepy during the day, what your mood was like, and then some very specific questions about close to bedtime. So within 2 to 3 hours of laying down to go to sleep, did any of these things happen? And then what kind of things you were doing shortly before going to sleep. So you lay down to go to bed at night and you'd fill out this. It would only take a few minutes about that previous day. When you woke up the next day, you would take a couple of minutes and you would fill out these questions on the other side. And so you would do this over the course of, like I said, for me, it was at least 2 weeks. And then we could use this to calculate some things that we'll talk about in a few minutes. Oftentimes, we will also ask patients to fill out some screening questionnaires. This is the Global Sleep Assessment Questionnaire. It's one of the most commonly used instruments. And so, again, we would ask somebody to either fill this out before they came in for an appointment or as they're sitting there in the waiting room, fill out these things. And these questions are specifically about the past 4 weeks. And you can see that, there's a variety of different questions. And when you look at these are screening for primarily dysomnias, which we'll be talking about in just a little bit. But we also have some about the parasomnias. So these are some common questions and screening instruments that we might ask people to fill out before they met with a medical provider. And so this would be part of a detailed history. So we want to know about their sleep habits. The sleep hygiene is what we would be capturing, some of that in the sleep diary. Using sleep diaries, we could actually do a calculation of how efficient their sleep is. So you may be able to sleep 5 hours, wake up bright-eyed and bushy-tailed, never feel draggy or drowsy during the day. So those 5 hours would be high-quality, very efficient sleep. Another person may sleep for 10 hours, wake up feeling horrible, be draggy during the day, maybe napping during the day. And so their efficiency of sleep, their quality of sleep would be lower. So using that sleep diary, we can diagnose many of these sleep disorders. Sometimes, though, we want to do a formal sleep study. And with that, we're going to ask somebody to come in and sleep in the laboratory. And when they come in to go to sleep, we're going to record lots of different physiological things going on in the body. So there'll be a sensor that will be sensing their respiration. This is usually a band around the chest that will kind of record the chest rising and falling. Oxygen level, you've probably had this in the hospital. They put a little sensor. Sometimes it looks like a little clothespin that pinches over your finger. My daughter was in the ER this week. It was, for her, it was a little red light, and it was kind of wrapped around her finger, and it kept track of her oxygen level. There are also a variety of sensors that we put on the head to measure EEG patterns. Today, most of the time, this is a flexible cap. So people will kind of put this almost like swim cap. It's kind of tight fitting cap over their head. It shouldn't pinch them, but it's close fitting. And it has lots of sensors that record electrical activity inside the brain. We'll put some sensors near the eyes to record the muscle movements of the eyes, and that helps us with REM sleep. And then we'll have sensors on some of the other muscles in the body. So there may be sensors stuck to the skin to record other muscle movements. And then also sensors to record the activity of the heart. And then you get all this stuff stuck to you, and we say, now sleep normally. And that may be kind of challenging. Usually there's also a videotape in the room over the bed, so we can record, how much the patient is moving, their sleep position, those sorts of things. Usually we start out by asking them to sleep at night. Sometimes we'll have them sleep at night and then get up and then stay awake for a while and then try to go back to sleep. And so depending on what we're looking for, we would set that up a couple of different ways. Now, another sort of low-tech sleep assessment is to use an actigraph. Back before we had things like smartwatches, these were really expensive pieces of medical equipment, and we would check it out to you, and it would look kind of like a bulky smartwatch, not nearly the microscopic technology we have today. And we would ask people to wear that at night when they were sleeping, and it would record how much they were kind of moving and flipping and flopping around. Now that we have smartwatches and Fitbits and things like that, sometimes we can use data from those. People are wearing those at night to help give us a little window of what's happening at home. Any questions about sleep assessment?